Hi guys, welcome to Pethopearls underscore Radhika. So we have been discussing about the various forms of cellular adaptations in the previous videos like hyperplasia, hypertrophy and metaplasia. So today we are going to discuss another form of cellular adaptation. So most of you know this famous personality, Stephen Hawking. So what did he have? He had spinal muscular atrophy. That means it could be due to a genetic cause. What happens? The muscles undergo atrophy. So the today's topic of discussion is atrophy. Okay, a cellular adaptation. So for those people who are movie freaks, so any guess what movie is this? It's a movie Okay Kanmani. What happens? You have Nitya Menon and Dulquer Salmaan who lives in this person's house, and this lady Bhavani, she gets lost one fine day and she couldn't come back to the house because she forgets the way to her home. So finally Nitya Menon and Dulquer Salmaan searches, somehow finds her and brings back to her husband, and they live together happily, right? So this is about the movie. So don't go into the further imagination of the movie. So what's the medical condition which she had? She had Alzheimer's disease. So what is Alzheimer's disease? It's a neurodegenerative disease in which you have deposition of abnormal proteins in your brain. So whenever some abnormal stuff is going to get deposited in the brain cells, they die. They have to die. And eventually what happens? There will be atrophy of the brain leading to various cognitive abnormalities, right? So Stephen Hawking had spinal muscular atrophy. In your brain, your Alzheimer's can lead to atrophy of the brain. So you need to know about atrophy, right? So the topic is atrophy, which is a form of cellular adaptation. So in my previous video, I was telling about hyperplasia, which means increase in the number of cells, hypertrophy, which means increase in the size of the cells, whereas atrophy is decrease in the size, or it's a reduction in the size of an organ. So why there is reduced size of a tissue or an organ? Because it could be due to either decrease in size of a cell or number of cell. Okay, you know about hyperplasia and hypertrophy. It's something which is opposite to that, right? Hyperplasia is increase in number of cells, hypertrophy is increase in the size of the cell, whereas in atrophy what happens? Both decreases. So this is the definition for atrophy, right? Next, so look at this image. If you remember the video on hypertrophy, I showed a image. What was that image? Of a cartoon character, Hulk, and the six packs. Whereas in atrophy, look at this. This muscle is normal. Whereas look at this muscle, it is atrophied. So once there is decrease in the size of the number, it becomes thinned out. Whereas in Hulk, the muscle is hypertrophy, right? So the muscles undergo atrophy. So the cells will have a nerve supply. If this nerve supply is cut off, your muscles can undergo atrophy. And sometimes if you are not using this limb for a long time, in that case also your muscle can undergo atrophy. Next, what is this organ? So if you remember in hypertrophy, I was showing an image of a uterus, a pregnant uterus and a normal uterus. But this has nothing to do with the female genital system. This is an image of a testis. So this is how a normal testis is supposed to appear in size in an adult. Look at this one. The size is decreased. So this is testicular atrophy. Okay. So why does this testis gets atrophied or it doesn't develop? So there are so many causes. One cause for testicular atrophy is undescended testis or cryptorchidism, right? So why do they develop in an undescended testis? So in undescended testis, your testis will be in your inguinal canal or in your abdomen. So it is not a very conducive environment for the testis to develop. So it will be atrophic. It won't develop properly. So if you remember all these, you can guess the causes of atrophy. So when you see this, I was telling when you don't have a nerve supply, the loss of innervation is one cause of atrophy. Then I told when you don't use your limbs, right? Your muscles can undergo atrophy. It's disuse atrophy. Then here, undescended testis, when you don't have an appropriate environment or when there is no proper endocrine stimulation, okay, your testis will not develop properly. So all these are causes for atrophy. Next, look at this. So this is a normal brain and this is an atrophic brain. It appears smaller. Do you agree? This is what happens in Alzheimer's in the late stage. Your brain undergoes atrophy, right? So what happens? Your brain has got sulci and gyri. With aging, because of the abnormal proteins, your neurons die and eventually leads to atrophy. So what happens? Your sulci will be widened. So this is an example for atrophy of the brain. And in many of the radiology report, you would have seen a term age-related atrophy or senile atrophy of the brain or age-related changes. They would mention like that. With aging also you can have atrophy of certain organs. One is brain, right? So this is called senile atrophy. So that's also one cause for atrophy. With age you can have atrophy of the brain. And whenever you have decreased blood supply, because of decreased blood supply you have senile atrophy. These are causes of atrophy. So what is atrophy? This is decrease in the size of the cell and the number of cells. Why? Because of decreased protein synthesis, and sometimes atrophy can be physiological. Why do we say physiological? Because during development, when the baby develops, okay, during embryogenesis, you have various structures will undergo atrophy. If it's persistent, it leads to certain remnants or some other condition. One example is thyroglossal duct. Okay, so thyroglossal duct you would have learnt in surgery. So as the thyroid gland develops and it's connecting from foramen cecum and the thyroid gland descends, right? So it undergoes atrophy. If it usually doesn't persist, it undergoes atrophy. And pathological thing I told about disuse atrophy, right? In hemiplegic patients, what happens? If they don't use the muscle for a long time, the muscles becomes atrophic. And deinnervation, I told about muscular atrophies, right? When you don't have a blood supply with aging, when you have a decreased blood supply, when you don't have a proper environment for development like malnutrition or loss of endocrine stimulation, and with aging, these are pathological causes of atrophy. And there is one important thing called brown atrophy. So what is brown atrophy? So brown atrophy is nothing but it's due to deposition of a brown pigment. So this is a histological image of a skeletal muscle. So you're seeing something like this. Okay, this is one muscle fiber, right? So all these pink ones are cytoplasm, the blue one is the nucleus. So when you see this surrounding the nucleus, perinuclear location, you have some fine yellow brown pigments. So this pigment is called lipofuscin. Okay, it's an yellow brown pigment which is perinuclear, right? When this gets deposited, you get brown atrophy. It can occur with aging in the heart. So I'll be discussing in detail about these pigment in further videos. So as of now, remember, lipofuscin can cause brown atrophy of the heart, right? So this is about the various causes of atrophy and what is atrophy. Now, when you take pathology, to make it a little interesting, you have two other conditions which is related to this color called brown. So you can post in the comments what is that. I'll give you a clue. So one is called brown tumor, which is related to what condition, that you should post in the comment. Okay, so if you know any other thing which is related to brown, you can post in the comments. So one is brown atrophy of the heart, another one is brown tumor. So you're going to post in the comment where do you get brown tumor, right? And if you know any other brown, you can post it. Okay, related to pathology. So I was talking about various atrophies. One other cause for atrophy is a condition called dermatomyositis. It's the immune mediated disease. You can affect many organs, your muscle and skin. and you have something called heliotrope rash and all those. So you remember in dermatomyositis, the muscles in the periphery will be small. So this is one characteristic finding, and this is an important question also. You get perifascicular atrophy. So the periphery of the muscle undergoes atrophy. Okay, it's a inflammatory myopathy. It's an immune mediated disease. It can affect multiple organs. You can affect your skin, your muscle and other organs. So as of now, remember, it causes perifascicular atrophy. I put this image because when I'm discussing atrophy, if I tell this, you will remember when you're studying in systemic pathology. So if your concepts on general pathology is strong, systemic pathology is going to be easier, right? So this is about atrophy, which we all discuss. So just to remember a cartoon picture. So if you continue to lie like that, you're going to atrophy. So what does this depict? Or disuse atrophy. Okay, if you don't use anything, it's going to get atrophied, right? Thank you for watching the video. With this, we are completing the cellular adaptations, the reversible forms, and we'll be dealing with further topics in the upcoming videos. Thank you.